Welcome back, Africa. If you're just joining us, this is Bottomline Africa. On a day, the Supreme Court of Kenya delivered that full judgment everyone has been waiting for. A judgment that eventually, of course, invalidated the election of President Uhuru Kenyatta on August 8th. And now, on our Twitter poll tonight, we did ask you, after listening or hearing the Supreme Court verdict for about 12 hours, I believe, are you satisfied with the judgment? After hearing the Supreme Court verdict, are you satisfied with the final judgment? Our Twitter handle is at KTN News. You can as well tweet me at Yusuf Ibra. Remember to always use the hashtag BottomlineAfrica. I'm going to go through some of your feedback within this program. Now, the health status of African countries is often marked by success stories. Numerous challenges. One success story is that Africa has produced its first ever Director General of the World Health Organization, Dr. Tedros Adhanom, an Ethiopian-born vocal champion of universal health coverage. Most African countries are yet to achieve this, despite many declarations and development goals where health has been prioritized. Now, the Ebola crisis came with many lessons on emergency preparedness and response, not only in Africa, but across the globe. Cholera outbreaks are still being experienced in African countries. The health workforce is still inadequate for the population. And most importantly, the financial resource to tackle these issues is still a major challenge. The big question, therefore, is what Africa is doing to keep its population healthy. What is Africa doing to keep its population healthy? I think that's a very important question. And let me reintroduce our experts once again. We have Dr. Rudy Egas, who is the WHO country representative. We have Dr. Uma Oluga, who is the Secretary General of the Kenya Medical Practitioners and Dentists Union, that is KMPDU. And Dr. Mirfen Mpundu is the Executive Director of the Ecumenical Pharmaceutical Network in Kenya. I had erroneously indicated Zambia earlier, but he is from Zambia. And last but not the least, we have Mr. Peter Yebo is the Executive Director of the Churches Health Association of Ghana. Many thanks, gentlemen, all of you, and welcome to the program. Good evening.
Good evening. Thank you.
So let me start with you, Dr. Rudy. And there's this report that the WHO released today, and it clearly stated that, the world is running out of antibiotics. Can you please break down that report for our viewers? Does it mean that, we're running out of stock, or the diseases or, bugs that have developed resistance towards these antibiotics?
For the question, so the issue is that as the world has become used to treating infectious diseases with antibiotics, we find ourselves that more and more of the infectious agents become resistant to these antibiotics. We know, for instance, about TB, that there are some cases of tuberculosis that are resistant against many drugs, so-called multi-drug resistant tuberculosis. And that's really what is meant by this new report that came out today, that increasingly we find ourselves in a situation that the antibiotics that we have been relying on to treat the infectious agents are no longer effective. It is still a small problem, but it is increasing rapidly. So what we need to do is, through the research and development of new antibiotics, find new ways of treating infectious agents. Well,
it is a small problem, but from the report, it's clearly indicated that this might be a global health emergency kind of thing. Now, Dr. Oluga, I'm sure you'll be following this report. And how did we find ourselves here? How did the globe find itself here with this kind of superbugs that are apparently immune to these antibiotics?
Thank you very much. Just to add to what Dr. Rudy has said, first of all, I haven't had much time to delve into the report, but I've seen a few of the highlights of the report in antimicrobial resistance. But I think this is not the biggest problem that Africa is facing in terms of health. Africa is facing a whole range of healthcare challenges. I think the whole healthcare system, not just with resistance, needs to be strengthened, needs to be talked about. In some countries, I think there's a near collapse of healthcare, and when you have a near collapse of the system, then you get resistance, because then the expertise and the use of antibiotics is also irrational. So that is how we got ourselves here.
Yes. Now, Dr. Mirfin, perhaps can you further explain to our viewers what these bugs or superbugs are all about that are have developed resistance towards these antibiotics?
Well, I would like to say thank you so much for this invitation, and would like to add some thoughts towards what my colleagues have said. I think one of the things that we have to, that has led us to get to this point has been that we've never taken care of the public good, and these are antimicrobials, and especially antibiotics. And some of the factors that has brought us to where we are is actually injudicious use of antibiotics, where they have been overused. We have overprescribed them, we have underprescribed them, and what that has led to, it has been the development and the progression of antimicrobial resistance. And now we are finding that we are unable to treat the very simple infections like urinary tract infections, actually including malaria, simple upper respiratory infections that we were able to treat with the basic antibiotics. So what that leads to is that if we cannot treat them really with the first-line treatment, then we have to go to actually use the second-line treatment, the third-line, and the fourth-line treatments. And the moment we start progressing, we increase the cost of treatment, and we also increase the length of hospitalization, the length of sickness, and what ends up happening is that actually people are sicker longer, and unfortunately, ultimately, they might be able to die. It is projected that, currently, 700,000 actually people die every year from bugs that are resistant. And most of these statistics are from the developed world. In African countries, we seem not to have a lot of data that we can use, but we can extrapolate and say, really, if the developed countries with the developed systems, and they've got so many actually antibiotics and antimicrobial agents, they've got this big problem. We must have even a bigger problem. We have this whole issue of the patients actually demanding more antibiotics. We have actually the selling of antibiotics in unregulated markets, and also in markets that are regulated, actually people can procure any antibiotics from the street and from the market, from a chemist. These are contributory factors.
Well said, Dr. Mirfin. Before I come to you, Mr. Peter Yeboah, who is from Ghana, of course, you're going to tell us shortly what Ghanaians are doing, to tackle any kind of health crisis there. Let me get your thoughts on this, Dr. Rudy, once again. This is not the first time that WHO has released this kind of a report, and one of the reasons for such bugs, it's clearly indicated that people don't responsibly use antibiotics. What needs to be done to tackle this problem?
So the main issue is that if you treat for instance, a viral infection, a cold, with an antibiotic, you're using the antibiotic in an inappropriate way because a viral infection does not respond to antibiotic. So by doing something like that, treating a disease inappropriately, you actually weaken the effect of the antibiotic. Similarly, if you start an antibiotic treatment, what happens frequently is that after a few doses of the treatment, the patient feels better, and they decide by themselves to stop the treatment, even though they haven't taken the full course. Again, it gives the bug the opportunity to grow resistant. A third way that the resistance happens is that these antibiotics are sometimes used in large scale in agriculture or in animal husbandry, and that causes the overuse of these antibiotics. And all of these uses then mean that the antibiotic no longer is effective against that organism that you're trying to treat.
Now, Dr. Oluga, let me take you through part of the report, and it says in addition to multi-drug resistance TB, WHO has also identified 12 classes of pathogens, some that can cause pneumonia and UTIs. These are diseases that are very common in African countries. So where will that leave the continent if this issue is not tackled now?
Pardon, I just repeat your question, please.
I was saying, let me just take you through part of the report by WHO today.
Yes.
This is what it says. In addition to multi-drug resistance TB, WHO has also identified 12 classes of pathogens, some that can cause pneumonia and UTIs, diseases that are very common in Africa as a continent. So where will that leave the continent if this problem is not tackled now?
So basically, yes, I actually saw the highlight on the TB and pneumonia, and some of the diseases are very common. I think let's start by saying that Africa it has one of the highest disease burdens in the whole world. So if we are also having a lot of antibiotic resistance, then that means that we are not going to be treating our diseases adequately. Already we are not treating them adequately, actually. Already we have a lot of deaths that are still related to TB, especially in the in the people that are do not have that have HIV, and then we have still malaria. We're still having a lot of children. Pneumonia is still one of the highest causes of deaths among children and also in the elderly. So with antibiotic resistance, if we don't tackle it now, then we're just going to get worse, because we already have the highest disease burden in the world as Africa. We already have other problems in the health system that are actually worsening even that disease burden. Mm-hmm. And then with antibiotic resistance, and particularly for TB and the organisms that cause the major causes of death, then I think Africa's healthcare system needs to be seriously sorted out, because it's just going to get worse.
Mm-hmm. Now, Mr. Yeboah from Ghana, it's not just cholera, malaria, and these are the diseases that is affecting the continent. We also have Ebola, which also resulted in the death of about 11,000 people in West Africa. So what is Ghana doing, and what is the organization doing to make sure that you have some sort of a healthy population?
Yes, thank you very much. And due respect to viewers, let me first before I respond to the question, let me first make a statement that would broaden the discussion so far on antimicrobial resistance or antibiotics. I think it goes far beyond the remit of the health sector. Remember that antibiotics are also used in veterinary, animal health, farmers, we have farmed fishing and the rest. So if we are addressing the burden of antibiotics and the resistance that is building up, we should also probably look at intersectorial issues that affect antibiotic resistance. Mm-hmm. That said, it is once again a pity that we are all the way reacting, that reactive response to health system issues that continue to bedevil Africa. From the perspective of Ghana and that of West Africa, we believe that universal health coverage is a pathway of promoting sustainable development goals, and also ensuring that we always adopt health system approach to issues that will affect us. So for Ghana, we in 2005 adopted a national health insurance scheme that is intended to strengthen our health system, improve access to healthcare by removing financial barriers, looking at essential service package, making strategic investments in human resource development, human health management information system, and other sectors that will strengthen our health system in response to infectious diseases and non-communicable diseases such as Ebola and the rest. So it is about strategic investment in health system and adopting holistic approach in matters of health, other than this reactive response to emerging infectious diseases and then issue of antimicrobial resistance. There are several aspects of this antimicrobial resistance or antibiotics issue that we have to consider. Yes. There are aspects that could be traced to low investment in health system, lack of training of prescribers, pressures from patients and clients. There are aspects of issues of demand and supply. I think that if we are to guarantee or provide health and ensure that the health of Africans are well guaranteed, there's always the need for us to adopt strategic approach, holistic approach to health systems, and that will be a good pathway to do so.
Well said, Mr. Peter Yobo, of course, there's need to have a strategic approach, and we're going to shortly talk about that Abuja declaration that has not yet been fully implemented by most African countries. Now, Dr. Murfin, let's talk about pharmaceutical companies and the role they're supposed to play. Do you think there's need for these companies to get involved in more research to make sure that they come up with antibiotics that are going to tackle these so-called superbugs?
Yes, thank you for the question. I think one of the things that we have to realize and take note is that the pipeline for antibiotics has been dry for over 30 years. The last class of antibiotics were actually, they've not been any new antibiotics really since 1978. And so from 78 up to today, all we've had and not any new classes. So we have to preserve the ones that are active. That's the first course of action. And I think once we start looking at the issue of, production, one of the issues that, really pharmaceutical companies have not been able to invest is that they don't see greater rewards in investing in new antibiotics. And so, yes, I think the world is working towards, these initiatives, to pool actually resources and put monies together to focus on actually producing newer antibiotics in the investment in research and development. But also there are initiatives of looking at those antibiotics that have been used in the past, to try and see, those that never made it in the pipeline, to try and see actually if they can be effective. But the most important thing for African countries is to try and conserve the antibiotics that we have now in using them really when they are required and for the right actually condition, the right dose and the right duration.
Well said. Now, Dr. Rudy, do you have any more solutions in store?
I think the one issue that hasn't been mentioned at all is the use of vaccines. So in addition to antibiotics and antimicrobials, of course, there have been quite a number of vaccines that have been developed. And these, of course, are part of the arsenal that we have against infectious agents. And vaccines are very, very effective. We know that measles vaccine, for instance, 95 out of 100 children that get vaccinated with this vaccine are then protected for life. So just by virtue of that vaccination. But now we have also newer vaccines against cancers, such as cervical cancer. We've got hepatitis B vaccines against hepatitis that also could cause cancer. In Kenya, actually, there's going to be a pilot on a malaria vaccine. So in addition to the antimicrobial resistance discussion, I think we should consider that actually vaccines are part of the future.
Yes. Finally, let's talk about the Abuja Declaration. Dr. Luga, before I come to you, let me just give our viewers a brief summary of what this Abuja Declaration is all about. And in the year 2001, in April, the African Union countries met and pledged to set a target of allocating at least 15% of their annual budget to improve the health sector and urged donor countries to scale up support. Now, 17 years after the Abuja Declaration, Dr. Luga, from your own observation, you can feel free to use any kind of case study, including Kenya. Do you think African countries have lived to that expectation? Have they implemented, the 15% budget award?
I think the answer is out in the public, and the answer is clearly no. So, in fact, the Abuja Declaration of 2001 was made with a lot of euphoria, in my own opinion. But also, I think there were clear indications that at that particular time there seemed to have been some progress in leaders making a political will to fund healthcare. But then I think along the way, Africa lost the plot. In fact, I think for me, the danger is that 11 countries actually have been reducing healthcare spending. And for me, Kenya and some of the East African countries actually falls under those countries that have been progressively in one way or another, you find the spending for health is not actually increasing. In Kenya, from 2007 up to now, it's been ranging somewhere between 6.7 and 4.8, depending on the year, and sometimes even lower. And if you look at across like the 6 pillars of the WHO, and then you find that there's also skewed or inequitable spending. So the story is that either there was lack of seriousness to declare, to adhere to the Abuja Declaration. As with the policy issues in Africa, I think there may have been maybe donor support, and then it was driven by external factors, and then we didn't have the will to follow it ourselves. And I think that has harmed Africa.
Dr. Luga, let's stick with the 6.7% you talked about Kenya, but there are people who are saying leave alone the 15%, even the 6.7% in many cases don't reach the people of the grassroots. Do you think corruption has anything to do with that?
Of course, there's a lot of health sector is one of the most corrupt in this country, and of course in many countries in Africa. And I think this is a subject that has been discussed. Just July of this year, the UN Rapporteur for Health presented a report to the Secretary General of the UN talking about corruptions and what drives corruptions in the health sector. And one of them was, of course, power imbalance and asymmetries. And then there is, of course, the fact that many of the policy makers, of the people in administration, do not consume those services. And therefore, they are very detached from them. Just giving an example, in our country, and even in the countries, many African countries, actually. In fact, this was discussed even, I think 2 weeks ago, there was a health ministers meeting in Zimbabwe. And it was also discussed, many African leaders go out, and even here within the country, you find even at the county level, at the regional level, the people who take care of the health, who make very critical decisions of life and death for the citizens, they go to private healthcare, they have very expensive insurances at the expense of the taxpayer. And therefore, they don't feel obliged to make the public healthcare better. They don't feel obliged to invest appropriately. So there's a lot of pilferage of funds. There's a lot of misappropriation. So they just take healthcare as another way of enriching themselves rather than as a way of providing services. That is why even issues of human resources for health are not taken seriously. In Kenya, we have had a lot of struggles with the doctors, and we still do have struggles with the doctors.
Actually, Dr. Luga, at this moment,
the clinical officers,
sorry to cut you short, even nurses and clinical officers are on strike, I believe.
As we speak right now. So there's a big challenge in the human resources for health, and that it's the same reason why, because none of these people go to the public hospital, they think that a nurse's strike is not important to them as an individual. They are not compelled to make a decision that will help end the nurse's strike. And these are some of the issues. So the same attitude, they bring it to the Abuja Declaration. They don't see why investing in health is important for the country.
Actually, we've exhausted everything. Well said, Dr. Luga. Now, Dr. Mirfin, let's talk about the Abuja Declaration once again. And, you know, it's strange. Even that city itself, Abuja itself, has not yet implemented anything about it. So does that surprise you?
You know, we have major problems, I think, in terms of actually living up to that. I think one of the thing to add on to what Dr. Luga was saying, you know, is in African countries, when the health budget is passed, by the time that we are getting to about September or October, only probably 50%, if we are lucky, 40% would have been released. And so that those funds that would have gone to strengthening the healthcare system, to procurement, to hiring actually competent staff, it is not available. And so we find ourselves that we are in a very embarrassing situation that, simple generic medications are not in facilities.
Yes. Let me cut you short, Dr. Murphy. I think we're almost out of time. Now, Mr. Yoboa, as well as Dr. Rudy, you have 30 seconds each. Now, Mr. Yoboa, perhaps you can take us through what Ghana has done with regards to this Abuja Declaration. And that will serve as your final comment.
Yes, thank you very much. I think both the spirit and letter of MDG and SDG recognizes health as both an input and outcome of socioeconomic development. And in my own country, Ghana, the percentage of health budget allocated out of our total annual budget is 7.8%. That is halfway, and the rest. Yes. I think the larger issue is about efficient utilization of the limited resources that we have in issues of disease prevention, health promotion, and of course, creative care, and the rest. Ghana is on a pathway to implement aspects of universal health coverage through our health insurance systems and the rest. But once again, it is about the way we prioritize health. It is about, having a paradigm shift within Africa, how we can assume responsibility for our health, and once again, making strategic investments in health, which is always an input and output of socioeconomic development.
We do hope the African leadership are listening to you. Many thanks, Mr. Peter Yeboah. Dr. Rudy, your final comment in 30 seconds.
Thank you very much. WHO still stands by the Abuja Declaration and calls on countries to actually meet that requirement. But at the same time, I think our Director General has made the point that that one metric is not enough. Universal health coverage is what we are talking about now. So how that money is being spent is very important. Access to health services, quality of health services, and what people have to pay out of their own pocket is critical.
Thank you. Thank you very much, Dr. Rudy Eges, for your input. Dr. Rudy is the WHO country representative. Dr. Ouma Oluga as well. I think you have something to say?
Yes.
Very briefly, please.
I just wanted to add that the WHO Director General, Dr. Tedros, has been running a campaign on the universal health coverage. And the recurring message has been political will. Because without political will, then you do not make conscious budgetary allocation of to achieve 15%, which is in the Abuja Declaration. So that is very important. The key message he has been driving across countries is that political will. If leaders consume the health services that they so prescribe for the people, then they will give money towards the Abuja Declaration. They will solve the problems of healthcare workers.
Dr. Ouma, unfortunately, we would like to hear more from you, but we are out of time. There is Dr. Ouma Oluga, the Secretary General of KMPDU. Many thanks for your input as well. Dr. Mirfin Mpondo, who is the Executive Director of the Economical Network in Kenya, as well as Mr. Peter Yeboah, the Executive Director of the Churches Health Association of Ghana. Many thanks, all of you, for your input within this program. Now, over to the images of the day. In the African context, a bees attack means different things to different tribes, ranging from good luck to bad luck. Well, I wonder what the victims of a vicious bee attack outside Kenya's Supreme Court today must have thought. In what seemed like a movie scene, a swarm of bees attacked police and protesters outside the Supreme Court, sending everyone running for cover after the arrival of the angry bees. It is not clear whether the bees came from, but some say the protesters disturbed a nearby hive. The protesters had assembled outside the court just as the Supreme Court judges began delivering their verdict, outlining reasons for nullifying the August 8th presidential election. Very dramatic day. We wish recovery to all those who got injured there. Now, on our Twitter poll tonight, we did ask you, were you satisfied with that ruling that was made by the Supreme Court? After hearing the Supreme Court verdict, are you satisfied with the judgment? That's what we did ask you. And 64% of you said yes, and 36% of you said no.